Hello, my name is Dr. Jeffrey Ganeles, and I'm a periodontist in Boca Raton, Florida. I'm very pleased to be presenting this new tool from Ostel for patient education. It's similar to a product I've used for years and has sold millions of dollars of dentistry and educated patients about what their problems are, how we can fix it, and what the sequence of treatment is going to be. After all, if we can't educate our patients about what their problems really are, then we can't really present valid treatment options and also build value for the procedures that we're going to do. So having visual tools like this that are flexible, that can be personalized, and can be very simple, non-threatening, and very fluid become a very useful part of our practice. I want to briefly show you some of the things that have been built into this software to give you an idea of what the capabilities are. This is an infinitely flexible kind of menu-driven tool that has all of the options you need directly on this front panel. So we have a light and dark mode. We can visualize the graphics. We can take the gums on and off. And all of these things are very easy and obvious to you. We can hide or show the sinuses, same thing with the nerve canal. And all of these things are important because we need to educate patients and we need to provide informed consent for them also. So I've prepared a little shortcut version of a treatment presentation to show what might happen to a patient who lost a central incisor. I use my name here because it's possible it could happen to me at some point in time. And I want to show quickly what's going on. Let's assume we put the gums back. We have tooth numbers available. They don't have to show. Often these confuse patients. We can simulate a smile line very quickly. And that's really important for patients because very often they don't understand what's visible versus what's not visible. Now I can show what happens if you lose a tooth along with the alveolar bone. This is a different situation from a patient who just loses a tooth but has an intact alveolar housing. The cosmetic impact of that is obvious. In the front of the mouth of the patient with a high smile line, we're going to have a cosmetic defect. So that if a patient then only has an implant placed, and here you see checking implant stability with the Ostel device, if we only do that, then this patient is not going to get a satisfactory result because the crown is going to be distorted and long compared to the adjacent tooth. And again, if we look at the final result, this is really going to be unsightly, unaesthetic, and really unacceptable to a patient. So what I've done here is stored another version of this that shows looking at what happens if we do graft. And you can see this is a very easy menu-driven process. It's intuitive. We don't have to spend a lot of time learning this. So let's look at what happens if we show this patient the same scenario with a bone graft. So here we start with the same bony defect. And instead of just placing an implant, we now do an implant and some sort of augmentation procedure. So the implant is at the correct vertical position. It's hard to simulate buccal lingual position with this because we're only dealing in 2 dimensions. But now the crown on the implant resembles the adjacent tooth. And at the final restoration, we now have symmetry, which creates all the difference in the world with this patient with a high smile line. So this is just an example of the kind of flexibility that's built in. And some of the other features, we've made this applicable to patients all over the world of all races. So we can deal with patients with darker complexions or patients that have all sorts of other differences from that standard one that we have here. Again, if we take the tissue off, we can take away an individual tooth. We can take away all the teeth. We can take away bone in one location. We can take away bone in all locations that you might have with a patient with an atrophic ridge. And we can place a single implant We can place one that has a slightly different look to it or a different design, and this is useful if we're looking at patients that have old implants versus new implants. And what's more, if we want to, we could talk about tilted implants. We could move them, swing them around. We have various opportunities to place different kinds of abutments. They could be fixed, or it could be an overdenture. And the type of restoration that's placed could either be a single crown, or it could be some kind of removable restoration. All of these options are built into this. This is incredibly flexible, and it is going to make explaining patient situations very easy and very productive, and it's very consistent with you, with your staff, and also with other doctors that may be treating this patient along with you, because everybody works off the same set of plans. This is a great tool. I really urge you to try it, to use it, and to start making your presentations as sophisticated as your treatments are. Thank you.